Hey, Dr. Zahn.
I think you have questions about your friend, right?
Yeah, I have a friend, and he's a little worried about what he's taking. He has seizures and epilepsy, and a doctor has prescribed a very potent medication for him. And what he's afraid of is the side effects are dizziness, sleeplessness, vision problems, trouble concentrating, and his balance is not right, and he's an older gentleman, and he's afraid he's going to fall. This medication also can cause liver problems. So what I'm going to see if he can come and meet with you, would you be able to do anything to either help him to lessen the amount of the medication that he's taking, but yet still get the same protections so he doesn't continue to get these seizures?
Let me ask you one question. So this gentleman, does he eat a lot of spicy food? Pepper, cayenne pepper, or?
Yeah, the first night that he had this seizure, he had eaten quite a few ghost peppers. He likes to think that he can eat the spiciest of foods and not be affected by it. So yeah, unfortunately, he does like spicy foods. He'll even take the cap off of a pepper jar and sprinkle the pepper on a steak or a piece of fish, and you can't even see it. It's so loaded with pepper. So, and I know you've told him previously to see if he could cut down on some of the salts and some of the spices.
So the seizure is a condition that there's a group of nerves in the brain abnormally firing up. So normally, the nerves will not firing up as intense as in the seizure patients. So when it's abnormally firing up, then the whole muscle spasm, they can bite their tongue, and the whole body can go into muscle spasm.
He did have that problem where he was biting his tongue and they had to put something in his mouth to protect. Yeah.
So the problem is anything stimulate the brain should be avoided so that you won't induce the seizure. And the reason the first time he got a seizure because of the gold pepper. Remember the gold pepper, when you eat it, you have to sign the consent form. They knew, somebody could get into a problem. Not everybody, but if this person drink alcohol, have other habits, then the nerves already inflamed. Then you eat a gold pepper, other spicy food, it can stimulate the nerves, induce the seizure. So in order to reduce the dosage of the medication, since he has been on this medication for a long time, I wouldn't suddenly stop. So the best way to protect him is gradually taper down the dosage. But at the meantime, he has to avoid anything stimulate the brain. Coffee, strong coffee, spicy food, and also any food induced histamine, like nuts and seeds, like alcohol can induce the histamine, sugar, high salt, high sugar, it's all induced the histamine causing more inflammation. So if there's more inflammation in the brain, then the nerve will fire up abnormally. And anything make him calm down, exercise or play golf or meditation, it would be a good way to help him to recover the nerve function. So in the future, he can reduce the medication dosage so that it avoid dizziness, sleepiness, those kind of side effects. But at the meantime, he can protect himself with the low dosage of medication.
Yeah, the dosage that he's taken now, he has made a lot of steps that you mentioned to correct this problem, so he could have the dosage reduced and maybe wouldn't have a seizure, but the doctor is afraid they don't want him to have these continued seizures. So they keep him on a higher dosage, even though he has stopped eating spicy foods. He certainly wouldn't eat ghost peppers again. And he's made some of the corrections that you've already mentioned. So how does he find out whether he can reduce that medication slowly and then, see if it still protects him from having a seizure?
I think the safest way is cultivate a new habit, meditation, relaxation, doing all the relaxing technique, and also avoid all the stimulants, even including the Coca-Cola, which has the ingredients which can stimulate the brain, and also the sugar substitute, high sugar. And if he can do that for 3-6 months and the inflammation going down, then it's the right time. Try to cut down the dosage one day, go back to the normal dosage, and then every other day. But he needs to talk to his neurologist to see if he could possibly every other day lower the dosage. If that's the case and he didn't have seizure for a long time with this, then you can continue to cut down. Because if you have lower dosage one day and normal dosage the other day, and then the nerves will not be hyperactive. But he needs to talk to neurologist first.
Yeah, and I'll also have him call your office for an appointment so you can discuss this with him.
Yeah, acupuncture is a very good way to balance the nervous system, calm down the nerves. And the other thing is acupuncture help reduce the inflammation of the brain. So not only for seizure, but also prevent future dementia.
Okay.
Thank you.
Thank you.